Good morning, and thank you for joining us here today. My name is Dr. Marcia Anderson. I am the Public Health Lead for the Manitoba First Nations Pandemic Response Coordination Team, as well as one of the First Nations members of Manitoba's First Nations Vaccine Task Force. I would like to acknowledge my First Nations colleagues from Assembly of Manitoba Chiefs, MKO, and Southern Chiefs organizations for all of their important and valuable contributions to this work. We know that First Nations people in Manitoba are more at risk of COVID-19 and at younger ages. In addition, many First Nation communities are at risk of evacuations due to fires and floods, or have geographical access issues that make it harder to get there. It's important that we get vaccines delivered into these communities and needles into arms as soon as possible. Today, I can confirm that detailed planning is now underway to schedule and staff COVID-19 vaccination clinics in these communities as soon as possible. We expect that this next phase of immunizations will begin in mid-March, and that by early to mid-May, all eligible adults living in First Nations community who want to be vaccinated against COVID-19 will have received their first dose. Since we cannot deliver all vaccines and human resources supports needed into all 63 communities at the same time, we have developed an evidence-based way to sequence this vaccine rollout. Communities at risk of flooding, fire, of losing winter road access, or where access to the community is across a waterway will receive their vaccines first. This will ensure that communities most at risk do not see their spring and summer hazards compounded by the pandemic and leaving them more at risk from potential emergency situations or evacuations. This sequencing plan also takes into account the experience of outbreaks and deaths within the communities. We know that communities that have had higher fatality rates, outbreaks, and lockdowns may be feeling pandemic fatigue more than others. As such, once the communities that are at the highest risk of evacuation due to flooding or fires are completed, we will then move on to communities that have had higher number of deaths and more significant outbreaks. Ensuring that these communities get the vaccine as soon as possible is key to protecting everyone. Right now, the planning work is underway. As you can imagine, this takes a lot of time, effort, and thought. As I noted previously, a more detailed operational plan is in development, and these details are expected to be released as soon as next week. Each community will be contacted directly about the timelines for their vaccine dose shipments and their surge supports. These communications will be occurring over the next week. At this time, we are planning to use the Moderna vaccine for all of these sites. This offers us more flexibility in delivering the vaccine, as we will have 30 days once it leaves the freezer for it to be used. In order to begin this next phase of vaccinations as quickly as possible in all 63 First Nation communities, some communities will receive their doses in advance of the human resource surge supports. They will be able to use their own assets and resources to begin delivering doses, with additional human resource support coming to complete their vaccine rollout within that 30-day period. With this plan, we anticipate being finished providing first doses in all 63 communities for those eligible by mid-May or possibly even sooner. I do want to note that when it comes to First Nations cases, there is not a severity gap between southern and northern communities. While we do want to try and reach some communities by winter road or before the spring breakup begins, we also want to ensure that Southern First Nation communities are also receiving the protection of this vaccine as soon as possible. I can confirm that vaccines will be shipped and surge support teams will be visiting First Nation communities within the geographical area of each regional health authority, both south and north, starting in mid-March. We're also looking at options to enable Southern First Nation communities to access a super site if they are eligible and don't want to wait for their community-based clinic. This will become available sometime in April, and more details on that will be released closer to that time. We know that reaching First Nation communities in one trip is more effective than making multiple trips, especially for communities that are challenging to access. Therefore, during this phase of the vaccine rollout, all First Nation community residents aged 18 and over will be eligible to receive their vaccine at the community vaccination site. Since this will be a higher number of vaccines than occurred with our initial phase 1 rollout, we're doing significant work to plan for staffing and surge support to provide those doses in the communities. Extensive planning is underway, including the planning for deployment of integrated, focused immunization teams. These will be modeled after our rapid response teams and will be a truly collaborative effort. This includes bringing people and providers from multiple organizations and jurisdictions together onto these integrated fit teams. This effort will be coordinated and operationalized through the Rady Faculty of Health Sciences at the University of Manitoba. We will be reaching out to communities as soon as possible to let them know more details as these logistics are finalized. In addition, our lead operational colleagues will be providing further information next week. With respect to the general population vaccine rollout currently happening in the super sites, a few people have reached out to us to express concerns about how their elderly relatives will be able to manage at the site. The site leadership at the RBC Convention Centre are working hard to address these concerns. Additional tables and chairs have been added that can be used to sit at while filling out consent forms if that's needed. Chairs have been added along the hallways and at the registration or check-in desks. In addition, chairs have been added where people need to wait in line to receive their immunizations. In addition, these staff are working at ways to reduce the total distance that people with mobility challenges will have to walk at the clinic. And I want to thank people for their valuable feedback, as this will help us improve the experience for everybody. We encourage people to call to make their appointments as soon as they are eligible. As of today, First Nations people who are 67 years of age and older, and the general population of Manitobans aged 87 and older, can call and make their appointments. I'll now turn it over to Dr. Reimer.
Thank you, Dr. Anderson. Good morning, everyone. I'm Joss Reimer, the medical lead for the Vaccination Implementation Task Force. A strong plan to immunize our First Nations communities across the province, as well as Northern Affairs communities and remote Northern communities, must be built in collaboration with our partners. So I am so pleased to be here with Dr. Anderson to be able to share some of the details with you today. For these prioritized communities, particularly in the north, the options of either the focused immunization teams or Vaxport in Thompson will be provided in order to accelerate access to the vaccine. Larger centres in the north, like Thompson, Flin Flon, the RM of Kelsey, and the PA, don't face the same challenges related to all of the things that Dr. Anderson just described. But we will continue to offer immunization at the super site in Thompson, as well as other options to provide COVID-19 vaccine to people living in those communities. So this may include mobile clinics. We've already set up some pop-up sites, for example, and we'll just continue to make sure that there is access in those larger centres so that people who are eligible according to the provincial eligibility criteria have their own place that they can go for the vaccine. This criteria expands regularly. As Dr. Anderson just noted, the age criteria has expanded again today. And so we are eager to continue to work with all communities to prioritize access. As you know, the National Advisory Committee on Immunization recommended earlier this week the spacing between first and second doses should be extended up to 4 months. On Wednesday, I also announced that Manitoba will take that approach. This means that we will be able to immunize Manitobans with their first dose faster. This helps protect all of us, no matter where we live. I also want to provide an update today on how we will be using AstraZeneca or Covishield vaccine doses that Manitoba will receive likely beginning next week. As you may recall, we have set aside the AstraZeneca to be used in our distributed model. So that means sending it to doctors' offices and pharmacies throughout the province. Our next step will be to tell those partners how many doses they can expect to receive, and also to share with them guidance on who should receive the vaccine. I want Manitobans to be aware of our plans, but I also don't want you to start calling your physicians or pharmacies yet, as you won't be able to make an appointment because they don't yet know how many doses they'll be receiving. But when you can, we will let you know. And I'm going to steal one of Dr. Roussen's usual lines and just say that now is not the time. So the eligibility criteria will include people aged 50 to 64, and we'll be recommending that the doses be prioritized for people in that age category who have a serious health condition that puts them at higher risk of serious outcomes. We have created and we've finalized the list of priority conditions that we expect the pharmacists and physicians to be prioritizing. I'm hopeful that we'll be sharing that list with all of the locations that will be immunizing with AstraZeneca later today. What we want to do is give the list of conditions to the physicians and pharmacists first so that they have an opportunity to plan, so that they can know how many doses that they're going to be receiving, and they also know who they should be prioritizing. So we want to give them that time to create their own plans about how they'll be scheduling appointments and whether or not they'll be reaching out to their patient populations or if they'll be setting up a system for patients to call in and book their own appointment. So once we've given them that chance to review the criteria and to set up their systems for booking, we'll then release the list of priority conditions for Manitobans to see. This morning, we also learned that Janssen or Johnson & Johnson has also been authorized for use by Health Canada. We haven't yet received any details from Health Canada about when to expect this vaccine will be available, nor anything about how many doses will be received in Manitoba. And we also haven't seen anything from the National Advisory Committee on Immunization regarding what their recommendations are for use. But we will update Manitobans with that information as soon as we have it. The goal of the task force remains the same. Regardless of which vaccine we have, we want to make sure that there's a vaccine available to every eligible Manitoban who wants it. In fact, I myself went yesterday and received my first dose. And I want to do that so that I can protect myself, but more importantly, my patients and my loved ones and the people around me. So we're working hard to expand what we have available for Manitobans and look forward to continuing to announce expanded eligibility, expanded products that are available, and keeping Manitobans up to date about what we know when we know it. And with that, we'll take your questions.
Thank you, doctors. A reminder to our reporters on the line, you will have one preliminary and one follow-up question. Up first this morning from the Winnipeg Free Press, Katie.
Hi, good morning. Dr. Reimer, I wonder if you can be a little bit more specific. I know that you said that you don't want to release plans too early, but for people who are going to be trying to plan and they're very curious when they may become eligible to receive the vaccine, how can people be best informed of when they may become eligible? Are there any timelines that can be released for when people can expect to receive more information?
So in regards to the AstraZeneca prioritization, our intention is to release the list of priority health conditions next week to allow our partners, the physicians and the pharmacists, time to develop their own booking plans before they start to receive phone calls from eligible Manitobans. So what I can say is that for right now, we will be opening it up to Manitobans age 50 to 64. With those high-risk conditions. I've already given examples of people who are on dialysis, as well as those who have severe liver failure to the point of cirrhosis. And and we will be expanding to include a number of other conditions and releasing that list next week. For eligibility more broadly, and because we are trying to continue with our age-based approach broadly in Manitoba, our plan is to continually decrease the age of eligibility. So today we were able to open up to Manitobans over age 87 and First Nations people over age 67, and we will continue to move down. I'm certainly optimistic that by next week we'll be getting close to age 80, and at that time we'll take some further assessment about whether there's any other groups that we want to add in because we've reached a threshold age, or if we want to continue with the age-based designation.
Okay, thank you. I wonder if you can tell us, for the appointments that are being booked, I understand starting today for the single shot vaccine appointments, how far in the future will those be held? When can people expect to receive just a single shot of the vaccine?
I believe, I'm just going to take a look to see what it says. Oh, I don't actually have that one in front of me. I'm going to have to take that one away and get back to you, but it will be shortly, if not today, that people can be expecting that when they call to book, that they'll be booked for one shot, with the intention that we will be notifying Manitobans when we are ready to start with the second vaccine. But I will have to confirm that with the team exactly when the booking, when the call center is switching over to that.
From Global News, Malika.
Hi, Dr. Reimer. I know at the end of what you were listing down there, you talked about Johnson & Johnson. I kind of missed that, so I just wanted to re-ask, with it being approved and only needing one dose, is that looking to go to potentially First Nation communities because of that accessibility? And do we know a timeline as to when we could get some here in Manitoba?
Yeah, so we heard, I think actually the press conference from Health Canada might be going on right now. And so, we've heard broadly that Health Canada has approved the Johnson & Johnson vaccine, but we haven't received any other official details regarding how it's going to be recommended to be used, who will be prioritized, nor how many doses or when those doses will be available. So I would say right now we're not able to create any determinations about exactly how that vaccine will be used because we don't know when or how much we'll be receiving, nor even who NACI will be recommending we use it for.
Great, perfect. And I know you had just mentioned by next week, hopefully getting to 80 and above, moving that number down for the general public. What about your optimism at this point? I mean, at the beginning, we had just Pfizer and then Moderna, and now two other ones get, AstraZeneca and Johnson & Johnson. What's your hope for getting all Manitobans vaccinated and potentially even having a semi-normal summer here?
Yeah, I mean, I'm certainly optimistic that we will be able to offer all Manitobans a vaccine by the end of June. I believe that there was a technical briefing earlier today that went through some of the more detailed planning that we're doing as far as what assumptions that we're making. But the more vaccines that are approved, the more likely that that June date becomes. And if multiple vaccines continue to be approved, we might even be able to move it up earlier than that for the first dose. Certainly we also know that we need to plan to provide the second dose as well for Manitobans. So even once we've got that first dose in, our work is not done. And we want Manitobans to plan to receive that second dose once we've gotten through the next few months.
From the Brandon Sun, Colin.
Hi there. I was wondering, what has the uptake percentage among First Nations people for vaccination been like so far?
Thank you for that question. We do not have the ability to calculate the uptake percentage yet for a variety of technical reasons, but I can let you know that as of today, over 9,000 doses have been administered to First Nations people. The number that have received second doses has increased as well. That information will be released in our dashboard today at 12:30, as well as on the AMC weekly Facebook Live for more details. We have had anecdotal reports that uptake has been very good amongst the elders and community who have been eligible to date, and we look forward to working collaboratively with our partners to continue to produce and refine data on the vaccination uptake and coverage.
How has your communication campaign to prepare First Nations communities for the vaccination effort gone?
Again, we've received very positive feedback on the vaccine information that has been shared. Since the beginning of the pandemic, we've worked with our First Nations organizational partners, including AMC, MKO, SCO, FINISM, as well as directly with communities doing community radio, NCI, APTN. So we have been, I would say, very proactive with those communications. And we also draw on resources by other First Nations organizations. And I'll just mention one, First Nations Health Authority, for example. There's also a targeted Indigenous specific campaign out of Women's College Hospital in Toronto. And so we are doing both our own as well as sharing the excellent information materials from others, and are receiving very positive feedback on the information that's being shared.
From CJOB, Will.
Hi, good morning, everybody. Dr. Reimer, how long do you expect it will take to distribute the AstraZeneca vaccine to clinics and pharmacies? And can you tell us how many sites you expect to ship to, please?
Yeah, I don't have the final allocation for all of the sites that we'll be giving the first shipment to. And so we'll be working on that and finalizing it today and sharing it with all of the pharmacies and clinics that will be getting a shipment with this first round. We do anticipate receiving 18,000 doses of AstraZeneca probably next week, is what we're being told by the federal government. And so we will be distributing all of those doses out as quickly as possible as soon as we get them. Because we want to have our physician clinics and pharmacies reaching out and immunizing Manitobans as quickly as possible after they arrive in Manitoba.
Okay, thanks. And Dr. Anderson, with the teams heading to each First Nation community, I'm wondering how long are they expected to remain there? Like, how big is the window for people there to get the vaccine?
Yes, thank you. So the total window depends on the parameters of the vaccine. And so at this time, we're planning really for Moderna exclusively, although that may shift a bit depending on supply. But right now, our planning is focused on Moderna. So we will have 30 days to use the vaccine once it leaves the freezer at the warehouse. As I mentioned before, some communities have assets and will start their vaccination programs before the surge team comes in. When we're doing the calculations for how many fit team members will need to be there and for how long, we make some different planning assumptions. So we assume that each immunizer will be able to do about 4.5 vaccines an hour and will work a 7-hour day. So the length of time that the team is there in total depends on the size of the over 18 population in the community. The number of team members who can go and can have accommodations, since accommodations can be limited in some of the communities as well. And then the days that they will be in the community will really be based on those two factors. So it will be different from community to community depending on the size of the population to be immunized.
From the Winnipeg Sun, Josh.
Good morning, doctors. My first question is for Dr. Anderson. You mentioned a lot of logistical challenges on getting the doses up to the north for some of those more remote communities, and that's why you're kind of focusing on them first. But when we look at second doses and getting those doses up there, would it have made better sense to make sure that we get those where access might be more difficult, get the second dose up to some of those more remote communities first before focusing on where the logistics are a little bit more simpler in the south?
So in terms of the second doses from our first phase of the rollout, by the end of day today, all 63 communities will have received their vaccine shipments for that first phase rollout. When it comes to our planning for this next phase, where we're doing the whole population 18 and up in an evidence-based sequence, we will be starting with communities both in the southern part of the province as well as in the northern part of the province. So we want to ensure that our Southern First Nation communities are hearing the message that they don't need to wait for the entire north to be done before they get access to vaccine. There will also be Southern First Nation communities starting their community-based rollout this month as well. We are still examining the prolonged interval that Dr. Reimer has referred to. We are planning to complete all first doses before we start the second doses, as Dr. Reimer has also said on behalf of the province, with some of the logistic challenges. And in our case, because we're deploying from the Rady Faculty of Health Sciences and, for example, planning to draw heavily on the health professional learner population who has been very willing to be part of the effort, we know they're going to need to be back in classes around August, mid-August. So we do add that level of logistic planning for our second doses as well. But I will just say that in line with the province, our plan is to complete all first doses in all 63 First Nation communities before we start those second doses.
Thank you for that. And my second question is for Dr. Reimer. And I know you don't have a lot of details on the Johnson & Johnson vaccine, on how much you will receive, but this is a different vaccine than what I think we've seen before. It's a one-shot vaccine, and it sounds like it's going to be a lot more easier to move around. It doesn't require the super cold storage. How does this change the approach for the vaccine task force in terms of getting vaccinations out to people? Is this going to be focused then more on some of the remote communities as well, or will this be looked at for some of the super sites?
So the intention for fridge-stable vaccines like AstraZeneca, like Johnson & Johnson, is to take advantage of the existing infrastructure that we have for our flu campaigns and for all other vaccines. We have a lot of very experienced immunizers in physician clinics, in pharmacies, who have a lot of expertise that are excited to get to participate in their settings. So our intention at this point is to use what we call the distributed model, or the physician clinics and pharmacies, for all fridge-stable vaccines. But we're also open to shifting approach if, say, we got a large volume of those vaccines. Perhaps we would consider doing it concurrently at the super site if we had a lower availability of the mRNA vaccines. So for now, the plan is to send all of the fridge-stable vaccines through the distributed model, but we would be open to using the super sites if we were seeing that we had a large discrepancy between the availability of different types of vaccines. Otherwise, we really want to use the existing expertise and infrastructure that has worked well for us for decades.
From CBC Radio Canada, Matthew.
Thanks. I don't have a question.
Okay, from CBC Manitoba, Bart.
Hi. First, for Dr. Reimer. Dr. Reimer, forgive me. For television, we do need you to repeat on this camera here what Mr. Bosa said this morning. Could you please go ahead and repeat what he said about May 18th and June 30th in a full statement for us? Thank you.
Unfortunately, I don't have his statement in front of me, so I won't be able to repeat exactly what he said. He does have a PhD, so you can call him doctor. That's also okay. But you know, I'm certainly optimistic that with our high dose assumptions, that we could potentially reach all Manitobans by the end of May. But it really depends on when those vaccines come in. We've received estimates from the federal government about how many we expect in Q2, but not when in Q2 those doses might come in. So it's certainly possible that we might see a large shipment at the end of Q2, in which case it would take us until the end of June to reach all Manitobans with their first dose.
Thank you for that. And Dr. Anderson, I know you were asked this slightly earlier, but given that Johnson & Johnson is a one-dose vaccine, and given that some of these more remote communities are very difficult to reach, and I'm thinking about the ones in the far northern remote areas, would there not be some advantages to holding off until you can get Johnson & Johnson, that you don't have to go twice at all?
You know, certainly as NACI releases its recommendations, and we will review all of the scientific evidence around its efficacy as well, we can consider whether or not we want to shift some of the doses. However, I would say we would not support an idea of holding off our current approach or rollout while we wait for that, and while we wait for not just the evidence and the recommendations, but also the specific allocations of it. We did have the opportunity to try the rollout to 63 communities with Moderna already once. And so we have some learnings and some successes to build on, and we are confident that we can do this again for the entire community-based rollout that we're talking about now between March 15th and roughly early to mid-May. The one opportunity I see as potential for either AstraZeneca or Johnson & Johnson is maybe to have available for people who miss their community-based vaccination clinics. They may be out of community, for example, for medical reasons or medical travel, or if they're acutely ill during the vaccine campaign and are unable to receive the vaccine at that time. Perhaps that is an opportunity we can explore with the vaccine task force to have some doses available in case they miss that mRNA clinic.
From the Canadian Press, Steve.
Oh, hi there. I'm wondering, with the new time frame that we were briefed on this morning about potentially somewhere between mid-May and end of June for a first dose, what can you tell Manitobans about what that might mean for a second dose? Because the second dose might be up to 4 months later, correct?
So the plan that we've made so far is dependent on the supply that we get through the federal government. And so, you know, this morning, I know that there was some discussion around what our planning assumptions lead to, and whether, you know, with a high supply situation that we might be able to reach all Manitobans in May. But if the doses that come from the federal government appear in June, then obviously we would need to be waiting until June before we could reach all Manitobans. So we are comfortable with the evidence that we have today to delay the second dose up to 4 months. But we'll be watching the evidence to determine if it continues to be safe to do that, or if there's any evidence that people's immunity is decreasing. Likewise, we'll be watching to see whether or not the second dose might be more effective if we wait a longer period of time. We have seen that in other vaccines, even in the AstraZeneca trial. We saw that the longer delay between the two doses helped the second dose be more effective or more efficacious than the earlier dose. So right now, the plan is certainly to start dose 2 when we've completed dose 1. If that's earlier, if it's in May that we complete dose 1 for all Manitobans, then we would move on to dose 2. We have no intention of slowing down or shutting our clinics down, but rather would move on to dose 2 as soon as we can, unless there's some data showing us that there's a benefit, a health benefit for Manitobans to continue to delay the second dose.
Thanks, Dr. Reimer. And as a follow-up, some Manitobans might be worried that, as of today, nobody's booking a second dose appointment. That might create some uncertainty. So what can you say to assure Manitobans that, there will be a second dose and the effectiveness of the first dose as we're getting more scientific information in?
So we're very confident in the data that we've seen so far regarding the effectiveness in the real world of the first dose. We've seen data from BC, Manitoba, Quebec, the UK, Israel, and all of them are showing that after one dose, we see real world protection of 70, 80%, which is very good. That's when we look at those numbers in a real world setting for a vaccine in public health, we're very happy to see that because we know that if we could reach all Manitobans with a vaccine with that level of effectiveness, we would be able to get rid of the circulating virus. We would have what we call herd immunity, meaning that we start to protect each other if we don't carry the virus. And so while we're being cautious and making sure that we continue to watch the science to make sure that that immune level stays high, we're also very optimistic based on what we've seen so far in all of those places that I just named, that this will protect Manitobans. But we also think the second dose is very important. So just because that first dose is providing a good immune response and protection now, doesn't mean that we don't need to get that second dose for everyone. The second dose not only can boost the immune response, so can make your protection better, but it also lengthens the time that your immune system remains aware of that virus and ready to fight the virus. So the second dose becomes particularly important when we're thinking longer term. And the last thing that we want is to have the same experience in the fall that we had this fall, where we start to see cases go up and we have to shut down businesses and tell people to stay home. We absolutely don't want to do that again. So that second dose for that prolonged immunity is really critical. So our intention is not only to ensure that it's available, but to really support Manitobans and encourage them, strongly recommend them to get that second dose for all of our benefit.
From CTV Winnipeg, Michelle.
Hello, I'm just reading this release on the First Nations rollout for the community-based clinics. It says that 47 Northern Affairs communities will be included. That includes Métis and other First Nation and non-Indigenous populations. I'm just curious, what sort of discussions went into adding these in if they weren't already in the scope of this campaign before?
So one thing I think it's important for people who maybe are less familiar with some of the geographical aspects of First Nations communities in Manitoba and the history of some of the First Nations communities in Manitoba is that many actually have adjacent communities, and they're referred to in the news release as Northern Affairs communities, although they're not all strictly speaking in the north. And for a variety of reasons, in the way that colonization has impacted both First Nations and Métis people, those communities often contain large populations of Métis and First Nations people, as well as non-Indigenous people. Now, in remote First Nations communities, however, the nursing station is often and mostly the only healthcare provider. And so those adjacent communities always get their health services through that nursing station in these communities. And so with the larger vaccine planning rollout, it made the most sense to use the usual healthcare service route, which is the nursing station or health center in the First Nation community provides service to everybody in that proximity. And so that is the principle that's being followed with this rollout.
Thank you. Dr. Reimer, I'm wondering if there's any evidence to show that it's okay to delay the second dose for everyone. And by that I mean, like, are there any populations where we know that we should be getting that second dose sooner?
That's a great question. Thank you for asking that. So what we're basing our decision on is the data that we saw from BC, Manitoba, Quebec, the UK, and Israel. In all of those settings, elderly individuals in some way or another were prioritized. So if we're looking at the Canadian jurisdictions, it was largely personal care homes, and in the UK, a more broad elderly population. And so the elderly people are where we worry the most about a strong immune response. We know that as people age, their immune response becomes weaker, which is why we were so concerned initially with getting the second dose for all personal care home residents in case they did have a lower immune response. The trials that were run by the manufacturers didn't focus on elderly populations, and in some cases didn't even really include them. So we initially didn't have any data to tell us how elderly Manitobans might respond and whether or not that first dose would be effective for them. But we saw very clearly, and particularly in the Canadian data, because personal care homes were targeted in all of those jurisdictions, we saw very clearly high rates of protection in those settings, which was incredibly encouraging. So the group that we worried the most about an immune response had a good immune response. In one of the jurisdictions, it took about an extra week before they reached that full immune response. But that extra week wouldn't have any impact on the timing of the second dose. Just something to keep in mind that it takes a little bit longer for an elderly person to potentially build that immune response. So there was no population that ANASI recommended we take a different approach with because the highest risk individuals seemed well protected by the first dose. But we would continue to watch that and see if there's people who have really unique circumstances where perhaps they're having a transplant that could have a large impact on their ability to mount any immune response. And we might need to make some individual assessments of people's needs when they have these extreme examples of an immune response or lack of an immune response. But broadly speaking, the data has been very encouraging that that all Manitobans should be well protected, even as we watch to get those finer details.
Our final reporter this morning from City News, Jonas.
Good morning, doctors. Dr. Reimer, first question for you. For folks that may be looking at, the effectiveness of AstraZeneca and seeing that 62% number, just maybe a clarification for folks that may have concerns about its effectiveness or what this could mean as it does roll out to doctors and pharmacists.
I'm really happy to talk about the AstraZeneca numbers because they're confusing and they're complicated. They're more confusing than the other manufacturers, which I think are already difficult to understand. AstraZeneca ran essentially multiple trials in multiple countries and found a pretty large variety of efficacy depending on what setting their trial was in. So the 62% represents an overall count of most, but not even all of the participants in these trials. And what we've seen in the real world is actually a higher effectiveness than what they saw in the trials. So the data that we've seen from the UK so far has been very reassuring that the effectiveness was more than the 62% in the elderly populations and all populations that had been immunized in the UK. And this is something that, it's sometimes surprising to see a higher effectiveness in real world, but it's not surprising to see differences. The trials are done with different populations in different countries, with different amounts of virus and different variants of virus circulating. So comparing them head to head doesn't necessarily reflect how well they work. And so what we are now seeing when we really use them is they're all showing strong effectiveness after that first dose. And in particular, because we've targeted elderly people first, that's an additional reassuring point that the people who we were the most worried about whether or not it would work in are experiencing that protection. So I wouldn't focus on the 62% at all. There's other numbers in the trial. For example, 100% of people in the AstraZeneca trial avoided hospitalization, and there were no deaths in those who received the AstraZeneca. And really, that's incredibly reassuring as well. And in the UK, we actually saw AstraZeneca did better than the mRNA vaccines at preventing hospitalization and death. And at the end of the day, that's really the goal here. I mean, it's a wonderful bonus to prevent mild illness, but we wouldn't have, shut down society if we had a regular cold circulating. It really was about protecting people from those severe outcomes, which AstraZeneca appears to do very well. So the numbers are going to continue to change. We're going to see different numbers from every study that gets done on these. But what I can say consistently across the board we're seeing is that all of the approved vaccines have been safe and have been effective at protecting people from the severe outcomes of this virus.
Thank you so much for that clarification. I think kind of important for this one. And just as we move towards the doctors, pharmacists rollout, again, a message to parents or, folks with underlying conditions that, now is maybe not the time to start calling your doctor. Maybe just a general message to folks that maybe little patience for a week, or what would you say to them?
Yeah, so I stole Dr. Ruson's line of now is not the time, and so what I'm referring to is now is not the time to call your doctor or your pharmacist to see if you're eligible, because they don't yet know how many doses they're getting, and they're only today receiving the list of health conditions. So we need to give them a little bit of time, because every pharmacy and every clinic is going to have their own process that's the most efficient for them, to make sure that they are reaching those high priority individuals. So some of them are going to want their phone numbers to be available so that people can call. Some are going to prefer to reach out to their own patient population who they're aware of has these high risk conditions. So next week, once they've had time to know how many doses they're getting and approximately when they'll be coming, and know who should be targeted, that's when we'll start to provide that information to Manitobans about who we want to prioritize and how those clinics and pharmacies want to be contacted.
Thanks, everyone. This concludes our media briefing.